Okay, my name is Robertson Collier, and am in the classroom ELRC 7450 with Dr. Carlos Lee. And today I have with me Miss Leanne LaCour. As you can see, say hello, Miss Leanne.
Hello, how are you?
As you can see, I did get permission from Miss Leanne to do the clinical supervision cycle with our research for the educational purposes of the videotape that we need to utilize in order to make sure that this observation is complete. So I'm going to go ahead and with my questions that I have for her. For the pre-observation form, Ms. Lee, I just want to let you know that the purpose of this form is the teacher and evaluator must have a pre-observation meeting to prepare for the classroom observation and to review the teacher's lesson plan. And during the meeting, the evaluator and the teacher must complete a pre-observation form. So today I'm going to have her sign the pre-observation form with some of the questions that we are asking that I've already filled out. And we'll go over those as well. Okay, so some of my questions that I have for you while you're doing that is, how long have you been in the teaching profession?
I have been in the teaching profession for 5 years, but only 1 year in the classroom. The previous 4 years were in a daycare setting, assisting other teachers.
Okay. And just to let you know that our program is a Head Start program, and we're under daycare licensing as well. We service children 3 to 5 years old, and once they leave our facility, they can go into our pre-kindergarten program, or they can go into a kindergarten program if they're 5 years old. Number 2, why did you choose to become a teacher?
I chose to become a teacher because I have a special needs son, and I saw the impact that his teachers and therapists had on his life, our lives, our whole family's lives, and I wanted to be able to do that for other people and their children.
Great, okay. Can you tell me a little bit about yourself?
Sure. I previously worked in the medical field for 6 years, and I decided to help my cousin open a daycare because the commute to work to the hospital and the hours with my children were no longer working out. Then that's when I decided that I enjoyed helping early education and being a part of that. So that's why I decided to go into the school system.
Okay, great. Your degree, do you currently have a degree?
I do. I have an Associates of Science and also an Associates of Surgical Technology. But I'm also in school. I graduate in December, hopefully.
Congratulations.
Yes, with my bachelor's in psychology. Then I'm gonna hopefully take the praxis and pass. Then maybe I'll carry on to get my master's in special education. Maybe,
Right.
maybe.
So you are seeking higher certification?
Oh yes, sorry.
Yes. Oh no, you're doing great.
Skipped a question.
Okay. Do you have any areas where you feel you can? Do you have any areas you feel you can strengthen as a teacher or improve in while you're in the classroom?
I do feel like I don't explain things well. I kind of rush through things, and I try to make myself slow down and explain it better to the kids. I guess I get excited to see how they're gonna do it. So I need to take a step back and bring it down to their level and explain it better, why we're actually doing it and what we're supposed to be getting out of it. I do find I need to do that better.
Okay. What are your strengths as an educator that you feel you can help others achieve in your classroom?
I think having a special needs child has given me more patience. I'm able to kind of step back from situations and kind of look at the whole picture and see how I can help that child get through their feelings.
That's the word I was looking at when you were talking about some of the things that you want to work on. Just having a little bit more patience with the other children, but even having a special needs child, it's giving you that patience So you can kind of slow down, yes, sometimes, so you can kind of slow down. Do you plan to teach until retirement, or do you have other goals?
Not sure, I guess, yeah, I'll teach it.
Normally the retirement age is like 55 or over, so do you plan on teaching?
Probably, I mean, I don't see myself doing anything else,
Okay.
unless I meet a billionaire and he. No, I'm just joking, that's a joke, it's a joke.
I love it. I love it. I was like, yes, I like that. What outcome do you plan to have for children in your classroom as they move to the next level?
I'd like to see these children have a sense of curiosity about the world around them and use that to communicate with others, their peers, their adults, and then also use that to,
So what I hear is to be more alert and have more the conversational tools.
right,
Make sure they are able to conversate more with their peers and things like
right.
that. Okay,
Explain their needs.
great. And we have our end of the year outcomes when it comes to where the children are and then where would they be at the end. So we'll be able to assess through that as well. Our first fall level has came out already, so we have those percentages, and then we'll take those percentages and the data that we use for those outcomes, and then we can compare them to how we'll end up in the end. So we'll look at that again towards the end to make sure that you have met those needs for those children. Do you have any questions, comments, or concerns for me? Okay, well, that concludes our pre-conference questions. Thank you again, and I'm Robertine Collier.
And I'm